Hello everyone, this is Dr. Marty Ross. Today's presentation is about hacking Lyme disease action steps for recovery. In this presentation, I'm going to discuss 9 key hacks that you can use to improve your chances of having a good outcome when you treat chronic Lyme disease or other tick-borne infections. So in terms of resources that I'm using for this talk, first, I'm using information you can find at this Lyme disease information site, Treat Lyme by Marty Ross MD. And the key areas that you can look at are my online guide right here. And that will pop down. You click on that, it creates a big mega menu, and it'll show you how I've organized lots of the information here. I'm also going to be talking about aspects of my Ross Lyme support protocol, which you can find under the Lyme protocol tab here. And I'll also be talking about pulling information from my latest book called Hacking Lyme Disease: An Action Guide to Wellness. You can purchase that through my supplement store, Marty Ross MD Supplements. It's also available for sale through Amazon as well. All right. So during the talk, there's 9 different hacks I'm going to discuss that improve your chances of recovery. One of those hacks is to make sure it's not mold toxicity. Number 2, identify which infections you have again and again and again. Number 3, treat all locations and forms of Lyme. Number 4, treat growing and persister hibernating germs at the same time. Number 5, if you have chronic Babesia or chronic Bartonella, break apart fibrin nest. Number 6, use oral peptides to repair damage. Number 7, reprogram your limbic system. Number 8, when possible, use herbal rather than prescription antibiotics to protect the gut microbiome. And number 9, fix key imbalances created by the infections throughout treatment for the best chance of recovery. Number 9 could also be called antibiotics alone will not get you well. There's many imbalances that Lyme and the tick-borne infections create that you need to correct to have the best chance of recovery, and I'll discuss those when we get to hack number 9. So the first hack is make sure it's not mold toxicity, even if your Lyme or related infection test is positive. So the issue with mold toxicity is you could have it and not know it, and it looks just like Lyme disease. The reason that the two can look similar is that both Lyme and mold toxicity trigger your white blood cells to manufacture too many groups of a chemical called cytokines. And cytokines are good and bad, but when they're made in excess, they give you the symptoms that we call Lyme symptoms, which are identical to the symptoms called mold symptoms. And those symptoms can be things like brain fog, difficulty thinking, body pain, fatigue, hormonal problems, difficulty with sleep, etc. All of those are excess cytokine symptoms, and therefore mold toxicity produces a syndrome similar to what Lyme disease looks like as well. So regarding mold toxicity, the one thing you need to be aware of is about 25% of people have a genetic predisposition where their immune system is not able to handle mold toxins if you breathe them in from the world around you, okay? Mainly from wet buildings, workplaces, or your home. And these mold toxins get trapped in a person, and then they can trigger ongoing cytokine excess, okay? The best test to figure out if you have it is a test that's a urine test, see if you're peeing out excess amounts of mold toxins. The 2 labs that I like using for that are either Real-Time Labs or Mosaic Diagnostics, which was formerly called Great Plains Labs. I do not like to use the lab blood testing as proposed by Dr. Richie Shoemaker and physicians that are trained by him. Shoemaker was the person that first discovered there is this problem with mold toxicity. The trouble is the type of testing that he does and people that are trained by him does blood testing to see if you have various inflammation markers that are elevated, like TGF-beta1, C34A, VIP, MSH. All of those blood tests are ones that might be abnormal from having Lyme in you. And so therefore, just finding that they're abnormal doesn't prove that mold is the cause. And that's one of the big missings with the shoemaker approach. All right, so to put this in context, I have had people that have come to see me that the only thing I did when I discovered that it might be mold toxicity is fix their mold toxicity, and we never had to treat them for their positive Lyme test, even when they had a bullseye rash. And so what the issue is when we test for Lyme, the testing we're doing is looking to see, have you had an immune reaction that shows you have Lyme? And if you have enough of those cytokine symptoms, we call that Lyme disease. Well, having a positive immune reaction like an immunoblot or a Western blot or an ELISpot test that's positive doesn't mean the germ is still in you. It just means you're having an immune reaction. The germ could be gone and you could still be having an immune reaction. So I have had people that have come to see me before that have come in. Person I'm thinking of, he came in with his mother who's a nurse. He had come to see me because another Lyme doctor in town thought he had such bad brain impairment from Lyme that he needed to get on immediate IV antibiotics, and they wanted a second opinion from me. And yes, he had a positive Lyme test. Yes, he had a history of a tick bite, but I took a careful history. And in the history, you try to ascertain, when did somebody get sick? Because sometimes that can determine whether it's more of an environmental problem, not a tick problem, okay? So he had had his tick bite, he had had, and had tolerated well, really never got sick from it. But when he first moved into a home that had black mold on the walls is when he got sick. And so we did the testing, his real-time test came back extremely high in various mold toxins, and I took time over 6 months to pull those mold toxins out, and he was 100% well, and we never did anything for the Lyme infection. So take a look, make sure it's not mold toxicity is hack number 1. Hack number 2, identify which infections you have again and again and again. So the issue here is that some people can have Babesia or Bartonella or intestinal yeast overgrowth that they test negative for, or for which they don't have symptoms initially, but they become more apparent as you clear layers of Lyme. So sometimes treating Lyme disease is like peeling the layers of an onion. It becomes more obvious what is there as you get further into treatment, okay? And then the issue with yeast is that treating with antibiotics increases your chances of developing intestinal yeast. Intestinal yeast trigger excess cytokines, which can keep you ill as well too. So my general game plan when I treat patients is about every month, every 2 months, every time they come in, I am asking them to see if they have symptoms suggesting Babesia or symptoms suggesting Bartonella or symptoms suggesting intestinal overgrowth of yeast. So in terms of how to diagnose Babesia, the best test these days is a test by IGeneX called an immunoblot. There also is the possibility of doing ELISpot testing through Armin or InfectoLab, but the IGeneX test is better because it's looking to see if you have an immune reaction against more strains of Babesia. In fact, it looks to see if you had an immune reaction against the whole family of Babesia that can cover the wide range of types of Babesia, including the new emergent strain, which is something called Babesia oticoli. The ELISpot by Armin and InfectoLab only look to see if you have an immune reaction against 2 strains at best of Babesia, so they miss a lot of it, okay? Now, if you do decide to test, and it comes back positive, treat it, all right? But testing often can still be negative, even with the immunoblot by IGeneX. And so I'm always at the initial visit and then every visit after that reviewing symptoms to see as Babesia become apparent. So if a person has enough Babesia symptoms like night sweats, air hunger, migraines, headaches, deja vu symptoms that they get frequently, severe fatigue, red spots on their skin, racing heart, dizziness on standing easily, if they have enough of these symptoms, I am inclined to treat for Babesia even if they didn't get a Babesia test or if the Babesia test was negative. And again, these symptoms can appear months down the road as you clear some of the Lyme by treating the Lyme infection. Same case with Bartonella. The IGeneX Bartonella immunoblot these days is the best test. It looks to see if you have antibodies against the whole family of Bartonella, which includes 15 strains that can infect you. And also it looks to see if you have reaction against 4 specific strains. By comparison, the ELISpot test by Armin and Infectolab is only looking at 2 strains at best, and it may miss a lot of the Bartonella people have. But if you do that test and it comes back positive, treat. But again, even Bartonella testing will miss it. And so I tend to want to look at the first visit and all follow-up visits to review, are there Bartonella symptoms that are becoming apparent to me now? And so the key symptoms we look at are pain on the soles of the feet, severe thinking problems, neuropathies and syndromes like multiple sclerosis, Parkinson's, ALS, tremor, seizures, psychiatric problems, ongoing anxiety, and air hunger. And if there are enough Bartonella symptoms, you treat for it. Okay, and then intestinal yeast is another condition you should review every visit or every month or so to make sure that it has not become a problem, because too many yeast trigger cytokines that will make it look like your Lyme is not doing well. So at the beginning of treatment, I'd like to use a screening questionnaire because I don't think there's any decent testing you can do. So I use a screening questionnaire, and you can find that at the Ross Lyme support protocol. If you score over 140 on that, there's a good chance you have too many yeast and I treat. After that first visit, after I have somebody on antibiotics, what I find to be more reliable is just reviewing symptoms that might suggest it. So first of all, if anyone has a major worsening during their Lyme treatment, I have to consider, could there be too many yeast? Because again, too many yeast start growing in the intestines from being on antibiotics. They trigger more cytokines that make it look like your Lyme got worse when in fact it's a problem of too many yeast, okay? So other symptoms to consider is sugar cravings, gassiness and bloating, increased skin rashes, pimples or acne, vaginal itching or discharge. Now, pimples and skin changes are interesting. And the reason that happens is that when you have too many yeast in your intestines, they release toxins that interact with the skin that can lead to predispose you to getting pimples and acne and even skin rashes in general. So if you're looking for more information about this, take a look at Kills and Prevents Yeast, a brief guide, Kills Babesia, a brief guide, or Kills Bartonella, a brief guide. These are chapters within my book called Hacking Lyme Disease, an Action Guide to Wellness. You can also find these as separate articles at treatlyme.net. Hack number 3, treat all locations and forms of the Lyme germ. All right, so Lyme germs can live inside of cells and outside of cells. They also have 3 different appearances. One of the appearances is something called a spirochete. That's the corkscrew-looking thing many of you have seen. They also have a microscopic cyst form of the germ. And there's another form called an L form where the germ loses its covering and moves inside of cells, all right? So we need to choose antibiotics as we treat that's going to address the inside of the cells, outside of the cells, and the different forms, okay? And usually that involves being at least 2 different herbal or prescription antibiotics. For ideas on how you would design such a treatment, you can take a look at the Ross Lyme Support Protocol or a Lyme Disease Antibiotic Guide found at treatlyme.net, or as a chapter in my book called Hacking Lyme Disease. Hack number 4, treat growing and persister hibernating germs at the same time. All right, so this is the latest in vogue idea, if you will, in the world of Lyme disease, and that is that Lyme has these things called persisters, and we should be addressing them. All right, so what's a persister? Well, the majority of Lyme germs are in a growing phase. And about 5 years, maybe longer now, Dr. Kim Lewis and his colleagues at Northeastern University in Boston were able to show in the lab that when germs were exposed to ongoing antibiotics, some of the germs would go into hibernation, or we call those persisters. And in a hibernating state, they could ignore the antibiotics, the regular antibiotics that we throw at them, okay? Subsequently, researchers at Johns Hopkins University have also shown that Bartonella can form persisters as well too. If we look at the studies, it looks like maybe 90% of Bartonella or Lyme is in a growing phase, but about 10% can go into these persisters. Now, not to confuse terms here, spirochetes and cyst can be growing or they can be persisting. It's not clear to me whether a intracellular L-form Lyme is growing or persisting, all right? So what I like to do with my treatments based on this information is while I'm having people on things to address growing forms of their germs, I also want to have at least one thing that they're on that's going to treat persisters at the same time. From an herbal medicine standpoint, my go-to persister antibiotic is something called liposomal cinnamon, clove, and oregano essential capsules. And that's a product made by a company called Doctor Inspired Formulation. A lot of people do one pill 2 times a day. But if a person can't take that, or it seems like it's not working well enough, the other herbal options are cryptolepis and another herb called Japanese knotweed. Johns Hopkins University earlier this year or about a year ago now, had experiments showing that cryptolepis, which we traditionally use to treat Babesia, actually is really good at treating growing and persister Lyme. And Japanese knotweed could treat growing and persister Lyme as well too. So I like using those. Prescription options are methylene blue and dapsone for Lyme and Bartonella. And then there's disulfiram, which was all the rage a few years ago. And that can be used to treat Lyme persisters, but doesn't do anything for Bartonella. So to learn more about options to treat growing and persister Lyme and Bartonella, you can see the Ross Lyme Support Protocol, a Lyme disease antibiotic guide, Kills Bartonella brief guide, and how to treat persister Lyme and Bartonella. You can find these either at my website, treatlyme.net, or at Hacking Lyme Disease, Action Steps to Wellness, my book, and you can find these as chapters there. Hack number 5. If you have chronic Babesia or chronic Bartonella, break apart fibrin nest with lumbar kinase. All right. So one of the reasons that people with Bartonella or Babesia may have a hard time recovering is that the Bartonella and the Babesia can weave themselves together with a blood clotting protein found floating in your blood called fibrin. And they weave themselves and form these fibrin germ nest. And then they get stuck on the blood vessel walls. And they're kind of walled off from the immune system seeing them and antibiotics being able to get at them. So one of the things that can be useful in breaking down the fibrin is an enzyme made by earthworms called lumbar kinase. It's an enzyme found in the skin of earthworms. And so I've been pretty impressed with adding this into my treatments to see what would happen. And so I usually use it as a 16 or 20 milligram pill. The allergy research product is a 16 milligram pill. The 20 milligram product is made by a company called Baluki. I find they work just as well, to be honest with you. So the one thing about using lumbar kinase that I've learned is I usually start people slow. I usually do 1 pill a day. And then I may increase it to 1 pill twice a day or 2 pills 1 time a day after they get through an initial herx on that, all right? The other thing, other enzymes like serrapeptase, nattokinase do not work as well for this. The lumbar kinase is what seems to work best for this. Hack number 6, use oral peptides to repair damage caused by the infections if you are not getting better on antibiotics. All right, so oral peptides this year have become quite the rage, and I've been using them in my practice and having some success with them. There are a couple I really like using because of their ability to repair damage, okay? So let me just talk quickly about what makes something a peptide. So peptides are made up of amino acids. They're the building blocks. Amino acids are also the building blocks for proteins. So what's the difference? Well, it's an artificial designation. So the Food and Drug Administration here in the States decided that anything that has more than 40 amino acids is a protein. Anything with less than 40 amino acids is a peptide, all right? And that's because as a protein, they could regulate it as a drug. They're not as inclined to regulate it as a drug if it's as a peptide, all right? They still regulate it in other ways, but not as a drug. And then, so these peptides, the one that, and then in addition, there's over about 100 different peptides that have been identified that the body makes. And so the two that I like to use often in terms of repair are BPC 157 and cerebrolysine. BPC 157 is used to repair tissue damage and of the musculoskeletal system, like tendons, joints, and it can actually help repair nerve injury as well too. So people with neuropathies, for instance. And so if you're somebody that's done a lot of antibiotics, 6 months, 9 months, year, 2 years or more, and you're still having a lot of joint pain issues, or you're still having a lot of neurologic dysfunction, consider adding in BPC 157, 1 pill 2 times a day. Give it at least 2-month try. You may, if after that time you're not having it, if after that time it seems to be helping, continue it, and as long as you keep getting improvements, okay? And then the peptide that is useful for brain injury is a peptide made in the brain called cerebrolysine. And it is sold by a company called Integrated Peptides as a product called CerebroPrep in an oral form. By the way, Integrated Peptides sells that BPC 157 as a pill actually too. But that cerebrolysine, also known as CerebroPrep, is 1 to 2 pills 1 time a day, okay? For more peptide strategies and information about other peptides that you can get orally, take a look at my article called C Key Oral Peptide Strategies to Repair and Restore in Lyme Disease and Mold Toxicity. You can find it at treatlyme.net, or it's a whole chapter in my book called Hacking Lyme Disease. Hack number 7, train your limbic system to release infection-triggered brain reactivity that perpetuates symptoms after being on antibiotics. All right, so your limbic system is an area of the brain that can become chronically turned on in an on position from having had chronic Lyme disease. This is an area of the brain that regulates our emotional responses, behaviors, fight or flight responses, fear and survival behaviors, as well as feeding the young and reproduction. And if it gets overly turned on, it can perpetuate a lot of the symptoms people have with Lyme disease. And so there are ways you can train your limbic system to turn off, not be as reactive. I'm usually thinking about doing these methods in people that are about a year or 2 years out, and we've done about all that we can do to get them well, and they're still not getting better. I might consider a trial of one of these programs, okay? All right, so the biggest 2 programs that do this are a method called the Gupta program and another one called Dynamic Neural Retraining System from Annie Harper. Kind of think of the Annie Harper program as more of a boot camp. It's a little bit more aggressive. The Gupta is much more of a Buddhist type approach, although they both use Buddhist type principles. Short of doing one of these programs, you can look at doing a meditative practice. You might even look at doing some counseling as well too. Hack number 8. When possible, use herbal rather than prescription antibiotics to protect the gut microbiome. All right. So the gut microbiome is gaining a lot of importance, and our understanding of what it does is gaining importance. And there is concern that if we injure the gut microbiome, that one of the reasons people a year, 2 years down the road from Lyme don't get full recovery is it may be due to injury of the gut microbiome. Maybe, okay? And it's a new idea. We're just scratching the surface on it, but it's something to consider, okay? All right. So the gut microbiome, to tell you how significant it is, approximately 90% of the genetic material in us is made up of the germs that live in our gut. And these germs are bacteria, viruses, parasites, healthy yeast. All these things make up what's called the gut microbiome. The things that it does is it helps regulate the immune system, signals healthy brain function, helps with food digestion, removes toxins and things that we're allergic to, and can provide many other healthy body regulation functions. If it gets disturbed, it may lead to ongoing body illness. So, what I like to do, knowing that this could be a problem, as I design my treatments, I'm doing things to protect the gut. So number 1, when possible, I use herbal antibiotics instead of prescription antibiotics. Herbal antibiotics have less of a chance to disturb the gut microbiome than do prescriptions, okay? And the second thing I like to do is to use probiotics to help promote gut health. In terms of herbal antibiotic options, Each one of my articles or chapters about killing the various germs in Lyme disease has sections in that describe what to do for herbal antibiotics. So you could look at a Lyme disease antibiotic guide, kills Babesia brief guide, kills Bartonella brief guide. Found it either on treatlyme.net or in my book called Hacking Lyme Disease. For probiotic strategies, take a look at the article called Probiotic Strategies in Lyme Disease, found at treatlyme.net or in my book called Hacking Lyme Disease. All right, number 9. This should be called, I call this throughout treatment, fix infection-related imbalances while killing the infections with herbal prescription antibiotics. This could also be called fix all the major problems because antibiotics alone will not work alone. All right, so let me show you what those things are that you should try to fix to increase your chances of healing. All right, so number 1, again, antibiotics alone often fail. All right, and the protocol, so you could take a look at my Ross Lyme Support Protocol because it's designed to fix and address most of the key imbalances that I have found helpful to correct as a means of helping you to get recovery. It's much more comprehensive than the Infectious Disease Society of America, ILADS, and CDC guidelines because I address all of these imbalances versus they tend to focus mostly on which prescription antibiotics should you use, okay? All right, so this protocol, these steps that I'm telling you that kind of round out that do more than kill the germs, are designed to boost the immune system, improve detoxification, speed recovery, kill the infections, and protect and repair the harmful effects of infections and the antibiotics that we use. It is designed to help improve low energy, pain, insomnia, brain neurologic and thinking problems, and immune compromise and suppression. All right. In terms of the references for the Ross Lyme Support Protocol, you can take a look at those on the protocol page at treatlyme.net, or you can look at the Ross Lyme Support Protocol in my book called Hacking Lyme Disease, An Action Guide to Wellness. So the first part of the Ross Lyme Support Protocol says get sleep. And I know that can be very difficult in Lyme, but the reason to get sleep is lack of sleep worsens pain, increases fatigue, and suppresses the immune system. And also getting sleep lowers those inflammatory cytokines, all right? Interesting enough, it's the inflammatory cytokines that disturb the sleep centers of the brain, but getting sleep lowers those cytokines. And a good amount of sleep is about 7 to 9 hours of sleep. So in my protocol, I suggest using L-theanine as an herbal option, or you can use an herbal sleep combination that is composed of things like valerian, lemon balm, passion flower, hops, yams, wild lettuce, L-theanine, and others, okay? And I'm just going to move through these slides, but you could go look at the protocol to spend more time studying how I recommend using these. Prescription antibiotics could be Zopiclone or Ambien for short-acting. Zopiclone's available in Canada, Ambien here in the US. Trazodone's another good option. It's an antidepressant medicine that has non-addictive potential. All right. Second thing I like to do after, in addition to having people get sleep, is I like to work with a low inflammatory diet. And the two ways to do that are to either use a plant-forward paleo-type diet, or if a person has a lot of allergies, to look at doing something called an elimination diet. In terms of this plant-forward paleo-type diet, take a look at an article at my website, and that's called The Best Brain Inflammation, Pain, and Energy and Detox Diet Ever. That tells you how to create a plant-forward paleo diet. You could also, if you're having allergic reactions to everything, take a look at the elimination diet to find food problems article at treatlyme.net as well too. All right. So get sleep, have a healthy diet. Third step is lower those inflammatory cytokines I told you about earlier. And what works well for that is either curcumin or an anti-cytokine combination that has a number of herbs in it that target cytokines. And one of those products, for instance, is a product called Cytoquel by Research Nutritionals. There are no prescription medicines that do this well. All right, number 4. This is the fourth thing that's a key essential part of the Ross Lyme Support Protocol, And thing you should do that will help your treatment in addition to using antibiotics is be an adaptogen. Adaptogens are items that have been used for thousands of years in Ayurvedic and Chinese medicine because they're shown to help improve people's energy and health when they're under stressful situations. A good adaptogen gives energy, helps immune function, and supports adrenal and thyroid function. The one I like using in Lyme disease is something called ashwagandha, and here's the way that you would dose that. All right, number 5, correct any hormonal imbalances you have, specifically for thyroid and adrenals, okay? All right, and so the one thing to be aware of, you can test for low thyroid, you can test for low adrenals, but sometimes people with Lyme have subclinical low thyroid, subclinical low adrenals, and you can still help their adrenals and thyroid work better. And the way to determine if you have one of those problems is to look at the symptoms, okay? So you could either, again, diagnose based on testing, or you can look and see if you have enough symptoms of low adrenals or enough symptoms of low thyroid and decide to treat based on those symptoms, all right? And so I list them here, but you can also find these in my protocol if you want to review that list in more detail. If you have low adrenals, I like using ashwagandha, or you can use a prescription medicine called Cortef, which is physiologic normal levels of a steroid, okay? If you have low thyroid, I like working with ashwagandha, and zinc, selenium, and iodine can help, or I'll use prescription desiccated thyroid called Armour Thyroid. Right. 6th thing I think somebody should be on when they have chronic Lyme when they're treating is a good multivitamin, which supports the function of every organ in the body and protects against some of the toxic effects of the germs and the antibiotics you're going to be on. Number 7, I like doing things to support detoxification. And so some simple things, don't put toxins in, like eat organic fruits, avoid gluten, scent, alcohol, and tobacco, and decrease emotional stress or emotional toxins, okay? But the way that I support liver detoxification is with a supplement called liposomal glutathione, and that's a 400 to 500 milligram pill one time a day, or you can use it as a liquid. The product I like for that actually is something called Trifortify by Research Nutritionalists. Part 8, get exercise if you can, all right? And the key here is exercise to tolerance. So that might mean at the beginning you're not able to do any exercise at all. It might mean as you start feeling better that you can add a block of walking in, all right? So the key here is find a level you can do does not make you worse the next day. That's the key, okay? You have to use your body as a guide. The reason to exercise is it increases blood flow to your tissues, which is going to get your antibiotics better into your tissues, and that can help with detox. Exercise also raises chemical called endorphins and encalphins, which have healing effects and can improve immune function. Number 9 in my Ross Lyme support protocol is called immune system boosters, but I don't have you take anything or suggest that you take a specific immune booster because the whole protocol is designed to boost the immune system. So getting sleep, lowering cytokines, detoxing, using an adaptogen, fixing hormonal problems, killing Lyme, yeast, and co-infections, exercising is tolerated, and being on a low inflammatory diet helps your immune system work better, okay? All right, and finally, another key thing to do during your treatment is to prevent yeast overgrowth, and you can do that with a good probiotic, as well as being on something that will swat down those yeast, like an herbal combination or nystatin. All right, so again, some resources you could look at to give you more detail. One would be to, if you're looking as a source to figure out which supplement brands you might use for some of the herbs I recommended, you can use the search bar up here at the top at my supplement store called Marty Ross MD Supplements. Type in curcumin, for instance, and see what shows up. So be aware I have hand-selected items for my store that I have found helpful in my existing patients. And also I've chosen from companies that have a track record of actually putting in the supplement what they say they put in it and of using high quality ingredients, okay? Another resource you could look at that will have more information for you and will give you dosing strategies, etc., would be to take a look at my book called Hacking Lyme Disease. I mentioned that earlier. You could buy that at my supplement store here. Again, if you're looking for more resources, take a look at my online Lyme guide at Treat Lyme by Marty Ross MD, or you could look at the Lyme protocol found on this page as well too.